Hi, hello everyone, good evening. My name is Lakshna Murli Vaman. I'm one of the in-house counselors at the National Cancer Society of Malaysia. Okay, and today we're going to be having a live webinar on building resilient support networks through counseling. And so I would like to introduce the next speaker, which is Malini Rama, my fellow colleague, who's also one of the in-house counselors here at NCSM. Hi Malini, how are
Hello,
you doing?
I am fine. How are you?
Doing quite well, quite well.
Nervous, Tension,
Yes.
Okay. So, how's your day? All good? Must be very
Not too bad,
tiring.
not too bad. I think new experiences every day, so it's all welcomed.
Okay.
So shall we get started?
Yeah, sure.
Yes. Okay. All right. Okay. As I said just now, everyone, today we're going to be talking about counseling for cancer care, okay, and building resilient support networks. So both of us, Malini and I, will be taking turns on just talking about certain topics, okay. So I'm going to move on to our next slide, which is basically an overview, okay, of what you're going to gain from today's webinar. So the first thing that we want you to be able to get, like, take away is understanding psychosocial needs of cancer patients, okay, or of people you are taking care of, or just those around you, okay. And then the role that family members and caregivers play in the cancer care system. The third one is, how do we integrate the peer and survivor networks into the already existing care system that the cancer patient has? And last but not least, the roles that we as mental health professionals play in the lives of our cancer patients. Right. Without further ado, maybe we can ask Malini what mental health really is actually. Maybe she can give us a brief introduction on what it is.
Okay, before I start about mental health, just wanted to ask you, Lakshana, how are you taking care of your mental health on a daily basis and all that?
Um, my methods are not perfect, but I believe it functions for me as an individual.
Mm-hmm.
But my methods are mostly talking to family members. I speak a lot to my mother whenever I feel stressed out, or I speak to my supervisor at work, right? And I
Okay.
try to reduce my stresses through that as much as possible lah. And for things that I feel like I can deal with, usually I just do something that I really enjoy first. I put that aside, put aside my stress, and then I come back to it when I really have the time and hit space to concentrate and focus on that issue. Yeah, so that's
Perfect.
what I do.
Okay, that's good. Keep practicing. Okay, many people will ask, like, what is mental health? Is it similar to health? I guess, like, yes, as much we care for our health physically, I guess, like, our mental health is important as well. So why we talk about mental health refer to a person's emotional, okay, our emotion, our feelings, it's all about it. Psychologically, okay, and also social well-being is very important, is how you interact and you connect with people around you. So mental health is component of these three important thing. And also we like to identify that it is how individual think, how we think, how we feel, and also how we behave, our body gestures and all that. So overall, mental health is your general state of well-being and state of mind. Okay, if let's say physically you are perfectly all right, no any issue, but mentally you are feeling stress all the time, you are not able to cope with your stress, your work stress, your daily life stress, okay, then it will start to affect everything as well. So that is how it's going to affect you emotionally, psychologically, and also your social well-being. But there is a difference between mental health and mental illness. I guess, like, when it's come to stress, coping with our daily life and all that, it is pretty normal. But if it is like beyond then, something you're not able to control, for example, your stress level is more than 2 weeks, more than 3 weeks, then it might lead to any kind of a mental illness. So mental illness is basically something that disrupt your mental state and also disrupt on how you feel, think, communicate, and behave. Okay, the moment over stress already get into depression, that is how it will disrupt yourself. You won't have the ability, like, to think, you want to talk to people, and also it's basically like, very poor appetite.
Mm-hmm.
So have to really take care of our mental health. When it's come to cancer patient, I guess like cancer can have a significant impact on a person's mental health. Even though how strong is a person, the moment they have been diagnosed with cancer, I guess automatically the stress will be there. Why me? Why it happened to me? And they will get into depression. And some, yes, some they are able to cope. They know how to what to do next and so on. Okay, so all this experience can be widely depending on several factor. I can say a person's stress level, especially for the cancer patient, it depends on the type and stage of cancer. A person who diagnosed most probably at the early stage, maybe zero stage or stage one, so maybe their mental health punya state will be a bit better, okay, because very high chance of getting the proper treatment and recovery period. But if in case someone has been diagnosed at the stage 3 or stage 4, imagine their mental state is not going to be good, so the stress level definitely will be very high. Okay, so that is about the type and stages of cancer. But also it depends on the individual personality and also coping mechanism. If a person, like by nature, someone who are able to take care of their mental health, they do their meditation, they can do their grounding exercise on a daily basis, then they will be able to manage their stress level in a better way. Okay, then also their support system plays an important role. If a person diagnosed with cancer, they have a very nice family members, they have their friends who can support them, who can be there throughout their cancer journey, then the recovery period will be much easier for their cancer, and also their mental well-being will be much better. Okay, and the last one, their previous mental health history is effect as well, because some person, before they diagnosed with cancer and all that, they already have issue on how to cope with their stress. They have maybe kind of an anger issue and so on. So the moment they diagnose with that, so their mental health punya issue might be a bit high on how they want to cope. So this is a
Okay.
general thing about what is mental health all about, and what is the difference between mental health and mental illness. Mm.
Okay.
Okay, so yes. Yes.
Okay.
So the second one is all about, yes, it's the topic that we wanted to cover actually today. It's
Yes.
understanding psychosocial needs. Why we find that the psychosocial need is very, very important for cancer patient. Okay. How strong you are. Okay, that is fine. But when it's come to certain thing, I guess you might need help from another person. Okay, it can be from a peer or a professional help. So statistics shows that every 9 in 10 cancer patients in Malaysia reported having anxiety. The anxiety can be the moment they diagnosed with cancer, and also the moment they completed all their treatment. Okay, the anxiety that we name it after they finish their treatment is usually we say it as a scanxiety. This is like, the moment they finish all their treatment, then doctors say, okay, you come back after 6 months to do a scan, or to do a PET scan or anything. That is where it will hit badly, where they feel that going for the scan, it's like, I'm having the anxiety, so we name it as a scan anxiety. So we can't deny this, that every cancer patient might in any way will have this mental health issue, they'll encounter this. While 70% of cancer patients, they will feel depressed during their treatment.
Mm-hmm.
Okay, so our role is very, very important at National Cancer Society, because we wanted to make sure during their treatment, their mental state is stable. They are able to cope with their side effect as long they don't quit and they don't like, say, I'm not going to continue my treatment. Okay, so this is based on the statistic. So next one. So as much we are talking about mental health, why there is a different about mental health challenges for non-cancer and for cancer patient. So these
Mm.
are all these challenges faced by the survivors and also the patient. Anxiety and stress definitely will be there. As I say, the moment they want to go for their appointment, they want to start their treatment, so they will hit with anxiety and their stress level surely will be a bit high. Okay, somehow some of our patient might get into depression. Okay, so again, stress is there. Body image issues, that another important part, because they find that they are not going to be look the same before they have been diagnosed and after diagnosed,
Right.
especially when the time they are undergoing their treatment, like for chemo they might lose their hair, eyebrow, and few other things that they feel that they are not going to look the same anymore. And also, imagine the removal of some body part for breast cancer. They might have to go for mastectomy. Okay, so it's like they find that I am not going to look the same. Okay, because it's going to be another person. My images is going to change, so that can cause stress as well. Okay, so next slide. Financially, as much, yes, some might say that we can get donation, we can manage and all that. As much the insurance coverage is there, it is totally fine. But financially, or also, it's not only about the cost for the treatment, but for you to maintain, as a survivor, they need finance help. For example, to get a good food, sometimes they can use the finance money for their transportation, because they have to go for hospital for appointments and so on. So money is another big issue and a big matter for a person also. Okay, so they might get stressed because they don't have enough money for certain thing. Okay, and also, based on my experience, like some of the survivor, they used to be the provider in their family. They used to be very supportive person, helping their husband. They also earn equally with their husband. For the moment they diagnose, sometimes they have to go for the unpaid leave and all that. This is where they will face some challenges when it's come to financial. Okay, so the grief and loss is basically the moment they diagnose with cancer, the grief will be there. Okay, the feeling of loss of, they are not going to be same anymore. Okay, and grief and loss can be for the patient and also for the caregivers. Okay, and the third one, which this one, relationship, I find that another important thing, because some might find that my relationship is not going to be same as much like before I've been diagnosed and after diagnosed. How people going to look at me? Okay, as a counselor, when I do my marriage counseling, one of the dilemma the couples or the marriage couple uh, used to have, that they say that their relationship is not the same anymore. Something is missing, something is lacking. They feel guilt that they are not able to be the wife that they used to be. Maybe as a husband, they feel that they are not able to be the husband that they used to be. So relationship also plays an important thing into the mental health punya challenges faced by our survivor and patients. Okay.
Right. Right. And I think that all those mental health challenges really segue into why the role of family of and caregivers is one of the most
Yes.
important parts in the cancer care system. Um, and this is where I'm going to be sharing a little bit about the benefits of having family members and caregivers be an active member of the cancer patients care system. Okay, so the question is, why is support from family members and caregivers important? right? And there's these two parts in that is very important. Okay, emotional well-being, right, and the improved treatment outcomes. So let's start off with emotional well-being. Okay, how does support from family members and caregivers actually contribute towards a cancer patient's emotional well-being? In terms of reducing stress and anxiety, I think this is something that is very common. Okay, when we see our patients, this is like you said just now, Manini, they have a lot of heightened stress and anxiety due to their treatment regimes. And because their treatment regimes are not short term, it's very long term.
Yeah.
Some of
Right.
them have
Right.
very, very long, and it's a process that not everybody goes through. It's very unique to that specific individual, right? And
Right.
so, and this is where family members come into play. When they are there, their presence itself provides that emotional stability that they need. They feel The patients start to feel less isolated, they feel less anxious because they know I can always rely on my family members. My daughter or my son is going to be coming with me for these treatments. They're going to be waiting outside that room or the hospital for me. The moment I walk out of my room, I know I can see their faces and feel less anxious or less stressed out. Okay, so that's one part, right? And another thing is it fosters a sense of security for them, so that they know when I go for my next appointment, I don't have to think so much about who's going to follow me. I know who will follow me, because the person has already their presence has already been known since the beginning of the diagnosis, or during the diagnosis period when they're receiving treatment. The family member or caregiver is already there. So that sense of security is very important, and that's why family members and caregivers are very important for emotional well-being lah, in reducing stress and anxiety. Another thing is motivation and encouragement. This is a very important one, I think, because a lot of our cancer patients, um, yes, they do go for their treatment. Having their family members there is important, yes. Some of them, they don't require this motivation and encouragement, but most of them do actually require that motivation and encouragement, because um, chemotherapy, radiotherapy, it's a very difficult process to go through, right? And it causes quite some to a certain extent, an amount of pain lah. Okay, and so when it comes to pain, not a lot of people are going to be able to handle it, and so they require that motivation and encouragement from family members to actually cope with that treatment, right? And then moving on, improve treatment outcomes. I think this is very well known in terms of research, right? Adherence to treatment, when family and caregiver support is very apparent in the cancer patient's life, right? They are most likely to actually stick through their entire treatment plan, right? They will take
Yep.
all their medication correctly. Their follow up is also very, very good, because their family also keeps them accountable, family members and their caregivers, right? And then they attend appointments without any kind of issues, and uh, they don't have as much stress or anxiety surrounding appointments, going up for their follow up care and everything else. Um, Last but not least, better communication with healthcare providers. This is important because family members and caregivers can actually help cancer patients who are afraid to speak to their doctors. This is actually reality. Some patients do experience fear about talking to their doctors. And this is not saying like doctors are scary or anything like that, but some patients do have that fear. And because of that, family members actually do have the ability to be that middle person that helps them communicate better with their doctors about what they're feeling, what they're going through on a daily basis at home, other than what is happening in the hospital, even in making informed decisions about treatment lah. Okay, helping them, support them by making sure that they are making the proper decisions. Family members are important in
Yep.
that. Caregivers are also equally as important in that. Okay, so I think this is another segue into our next one, which is cancer caregiving. And I'll hand it over to Malini again.
Yes, when it's come to cancer caregiving, it's basically the role of a caregiver. As much like we give importance to our patient and survivor, I guess like the caregivers also plays an important role throughout the journey of the cancer journey. So cancer caregiving is basically referred to the provision of physical, emotional, and practical support. If a person is there, okay, if they are helping you physically, they helping you physically, emotionally they are supporting you emotionally, and practical support like to assist you on your daily routine and all that. So that is a caregiver's role as well. Okay, so caregiving involves various tasks, like for example they can be a someone who assisting in a daily activities, managing the medications, and providing the emotional support. So but we can say that caregiving can be the family members, the whole family members, can be your neighbor, can be your close friends and all that. But when it's come to the primary caregiver, the main caregiver, I guess that their role is very very important. Okay, and as their mental health also will be affected as well. Okay,
Correct.
so many will think that, oh, we have to take care of the mental health for our patient and all that, but the moment like we start to talk with our caregivers, we do realize that they need help, they need
As well.
help as
Yeah.
well.
Yeah.
Okay, because we find that their role is very important, they are playing a multiple roles, they do
Mm-hmm.
like encounter so many issues within them. So that's why we always say the caregiver's dilemma is real, and
Yeah.
we are in a way of helping them. Okay,
Yeah.
so when it's come to impacts on the caregiver, why, how does this mental health impacts on caregiver? Yes, there will be an emotional strength. Okay, caregivers often experience stress, same, they will experience the anxiety, depression, the grief related to their loved one diagnosis with treatment. We always find that the caregivers always have the another mask where they don't show their emotion, they tend to be the strongest person. Because
Yes.
in our community people always say don't cry in front of your beloved one, then they'll get upset. you
Mm.
know don't show the sadness, you have to be positive all the time. I will say
Right.
that that is the main challenges will face by the caregivers, because they just cover everything, their emotion, their feelings, everything, they just like tutup. Okay, so
Mm-hmm.
that is one, the emotional strength will be there. The second one, physical demand, caregiving responsibility can lead to fatigue, sleep disturbance, and neglects of personal health. The moment they wanted to make sure their beloved one go to bed on time and all that, sometimes
Mm-hmm.
they have to be awake to make sure the beloved one go to the washroom safely, go inside,
Right.
come back. Have to sometimes, if it's a bedridden punya patient, they have to change the pampers, they have to give the milk, and so on. So sometimes there will be a sleep disturbance, they don't
Yeah.
have the deep kind of a sleep, and also neglect their personal health. They might
Right.
forget to take their vitamins, they might forget to do their exercise, anything. Also when it's come to physical demands, they will tend to neglect about it. Okay, another one is the financial burden. As much we say that the cancer patient might face challenges with financially, but we also agree that caregivers will have the same issue, because sometimes the caregivers will be the one, like, what to do, keep on thinking, do the planning, medical expenses, what they have to buy, for treatment, for their daily life, for the marketing and daily expenses. And also some might loss of income. Okay, they might not able to do any overtime job, they might not able to continue their part-time job ke, and so on. So loss of income and caregiving cost and impose a financial strain on caregivers. So we totally agree that the financial burden is definitely cause distress as well. Okay, so the next one. So if those who are watching here, you are a caregiver, it can be a primary caregiver, or you are just a friend to someone, or your really relative or someone has been diagnosed with cancer. You might be like think, how I can support my beloved one, how to support my aunt family, so yeah, I'm going to provide you a few tips on how to be supportive when you feel there is nothing more you can do. Not only financial help, you still can be there and help your beloved one. Okay, so the next one. So first one, you can always provide the emotional support. Okay, why I say it's not only by word you say, or call me when you need me, I will always be there. That, but make sure you keep your word, be present. Okay, so whenever like your someone that you know, they text you just to check, to ask you something, try to reply to them. Don't ignore the calls, like, because you already promised to them. So be present if they need you. Maintain open communication, it's very important. Okay, just be normal. Don't have to feel like, don't show your sympathy towards that person. Okay, so maintain your open communication, just be normal. You don't have to speak only about the diagnosis and treatment, you can also talk about something else. Okay,
Right.
express love and affection, this is much needed by all our survivors and patient. Okay. They always feel that, okay, now I might look different, now I'm being diagnosed with cancer, am I going to get the same love and care from my beloved one? So the doubt will be there, so just be casual, express your love and affection towards them. Okay, next will be the psychological and emotional strategy. If you think as a caregiver you really need wanted to speak to someone, please, you don't have to feel shy and all that. Seek counseling or therapy. Look for support group. We are from NCSM, we do have a caregiver support group, so you are not alone. Okay, mindfulness and relaxation techniques, you don't have to spend 30 minutes or 1 hour for you to do like mindful exercise and all that. A basic grounding exercise, or just a 10 minutes, relaxation, or listening to a music or song for 2 to 3 minutes, or just enjoy a cup of coffee or tea for few minutes, that is good enough for you to feel better. Okay, practical support can be a create a comfortable environment. Okay, maintain your routines. Okay, coordinate care. I always encourage the caregivers, let's say if you find maybe your mother diagnosed with cancer, not able to do much work and all that, but of course they also will have the guilt, like, oh, I cannot help my family lah, I am in a situation that I'm not able to do anything. So as a doctor, you might just get your mom to cut for you something, just to be there, talk to you, chit chatting while cooking and all that. So practical support can be included in any other way. Social and educational support, stay connected with friends and family. Okay, if you are not sure about certain treatment, you can always do your reading. Okay, talk to the doctors and so on. Preparing all the outcomes, make sure you can always discuss wishes and plan. It's okay to talk to your beloved one, what is their plan, is there any task has been pending and all that. And the another one, creating positive memories. Okay, this is very important for someone who's had been like with the advanced stage. If you feel that, okay, their health condition is getting worse and all that, create a special moment. They might want to have a special time with you. Take photo, talk about the memories, celebrate birthday, someone's birthday in the house. So you can always create a special moment with your beloved one. Okay. So for the next one, yes, integrating peer and survivor network. It is a very, very important thing. So with us today, we have someone very special, invited guest, familiar face, I guess like well known to people. I would like to invite Miss Adeline Joseph. Hello,
Hi,
Adeline.
Adeline.
Hi, good evening, Malini and Lakshana.
Good
Thanks,
Thank
evening.
Adeline,
you.
for
Thank you
joining
for having
us.
me.
Yes. So about Adeline, Adeline is the head of Resources and Wellness Center. At the same time, she is a peer support coordinator. So maybe she can share a little bit about her role as a peer support coordinator. Adeline, would you like to say anything?
Hi, like what Malini said, I'm a staff of the National Cancer Society. I've been with the Cancer Society for many years, and I was diagnosed with breast cancer when I was working with the Cancer Society, and I've gone on from there to help set up the Resource and Wellness Center because through my experience, the bosses felt that there was a need to have and the Cancer Society branch out into the support services that we want to give to the many cancer patients and survivors and their caregivers out there. So with that, I started to work at the resource center. I head the center now, and my job basically involves engaging with the many patients who are newly diagnosed and their caregivers, and I connect them. I work very closely with Malini and Lakshana, where we work together to provide that holistic support and recovery, help them on the recovery journey. Yep.
Yes. Thank you, Adeli. So yeah, thanks for your sharing. So I have this question to check with you to ask you. Okay, how for you, how important was it for you to connect with others who had similar experiences? Like maybe the point from your peer
Yeah.
punya point.
When I was diagnosed, it was way back in 1995. So I was about 30 plus, and other than Cancer Society, I did not know of any cancer organizations, or for that matter, any cancer support groups out there in the Klang Valley, which could afford to give me that support I needed for me and my family. But my, my family helped me through information, getting information from their colleagues or friends and all, but I never really got connected with survivors. So I felt very alone. You know, I felt like when I go to the hospital, yes, I see patients around, but we are all absorbed in our treatment. We got no time to say hi and discuss. At that point, I never knew how important it was to actually make connection with survivors. So
Mm.
but I was lucky, someone called me. I don't know how she got my number. She called and she told me that she was a survivor. Oh my,
Mm.
I still remember that evening. I was standing and talking on the phone, and I felt so good. I felt that, hey, I felt a relief. I really felt relief that somebody was in the same boat as me. Somebody was journeying that same cancer journey, and we communicated over the phone, and we shared, and her experience of many years of her cancer journey helped to give me that strength. Our conversations, her sharing was very invigorating. It gave me strength, and I felt that, hey, if she could do it, I too can. And turning back over the years, I feel that people look at me and I want to be that someone that people gets motivated, or that I want to be that someone that gives a little bit of hope.
Right. Yeah.
Okay.
And
Beautiful, Adeli.
that's
Yeah.
and yeah, that's totally, I agree. I think that's something that most of our survivors, including our newly diagnosed patients, really need. That little bit of hope really means,
Yeah.
really means a lot, right? And with that, Adeline, I have another question for you. So how do you think like a peer support network, right, actually would help a newly diagnosed patient?
Like
Mm.
for me, my experience, so I now there's so many support groups out there, so many organizations that people can go to. When somebody is newly diagnosed, they're completely lost.
Right.
Okay, it doesn't have to be a cancer journey for you to suddenly be put in a situation where everything is new. I think like getting into a new job or getting into a new college, it's the same, that fear. But with cancer, is life threatening. So the big fear is death. And you need someone who's gone through it to tell you that, hey, it's not, cancer can be fought and won, and you can go on to survive. You need someone, and you cannot hear it. Sorry, Malini and Lakshana, we cannot hear it from you. You will not be able to get through to us as much
Right.
as
The
the next
same.
person who's gone through that journey. I'm not
Right. Right.
belittling what you do, but you guys do great. But we
Totally
want
agree.
to hear it from someone who's been there. and done
That's
it.
why we always say the peer support is very, very important.
Yeah,
Yes, yes.
so what answering your question, Lakshana, it's important for somebody who's newly diagnosed to just come in contact with a group. I know we feel intimidated talking to a group of strangers in a room. Why should I
Mm,
pour out everything to someone I don't even know?
mm,
But
Mm-hmm.
but so sometimes NCSM offers where it's one to one. We
Mm-hmm.
offer like a
Mm-hmm.
buddy.
Yeah.
So with that I get to know you. I get to know the person. If I feel I cannot gel with her, I can always come back to Cancer Society and say, hey, connect me to somebody else.
yeah,
So,
right.
so that way we some of us who don't like that group setting, fine. But we
Mm,
encourage survivors to go and do the small group sharings, which
Right.
our support groups do run, sharing sessions. The sharing
mm,
session gives new patients an opportunity to meet someone who's had a long time survivor alongside someone who's also journeying the same phase as the new patient. So at different phases of cancer survivorship, you meet in a group sharing. And in a
mm,
group sharing, you can choose who you want to be closer with,
yeah,
like making friends. You can choose your friends. So the same way you choose the survivor who you think can motivate and encourage you.
Right.
So
right, right.
I think having a new patient should actually reach out because it gives them that sense of belonging, the
Yeah,
sense of not being alone in this journey.
Right.
right.
Right. And I think this ties into what I mentioned earlier about a sense of security, right? Providing
Yes,
that sense of
yeah.
Yes.
security to them as well.
And we want when we meet other survivors, we want that empathy. We will receive
Yes.
that empathy, unlike others out there, family, relatives, and all and whom we come across wanting to give that support. Sometimes it has a small bit of sympathy in it, you
Mm.
know
Mm.
and so we don't want sympathy, we want empathy, which we will only get from our peers.
Right.
Mm.
Um. And then one last question, right? How
Hopefully
how
we
would
have
you
time. Yes.
how would you like encourage? Because I've heard patients. There are some patients who actually have reached out to people at the hospital that they get their treatment from, right? And they have bad experiences with other peers from outside, and then when they come and seek help from NCSM, and we say like, I think you'd be a good fit for peer support, and we say that, and then they go like, oh, wait, hold on, I don't think so. So how would
Yeah.
you actually encourage someone like that to start building their network again, their peer network again?
Mm,
Okay. With peer support, yes, you look for people who've gone through the same journey. But when someone is when they're newly diagnosed, they're going to start on this cancer journey, which which sometimes looks very dark. It's a dark
Mm-hmm.
tunnel you're going through. You cannot really even get a glimmer of light, but you're just starting.
mm,
So it doesn't necessarily have to that person doesn't necessarily have to get support from peers.
Right.
If there's so many people around them that they can start building on that support network.
Right.
The first people the patient sees are the doctors and the treating team or their medical team. They will get the information, and the right reliable information can be found from there. So when somebody is just starting the cancer journey, it's maybe they're looking for information, which doctor
Mm.
to see, which
yeah.
treatment, which hospital. So again, that support can come from the medical personnel. As they
Mm.
go on, they will find the family is always there. But again, like you can choose friends, but sometimes family, there's so many of them. Everybody has got their own, what shall I say, way of giving support.
Yeah.
you know
Yeah.
so again, it's for you to choose who you want to get close with and journey. So that person usually is the main caregiver at the end of the day.
Mm.
you know
Mm.
so the main caregiver, is very important to have very good
Yeah.
communication. you know
Right.
Right.
Communication will help to break down a lot of barriers. Yes, family sticks by you. Like today I can get angry with my sister, tomorrow she's still my sister, and I know there's still love between us. So the family, you get to communicate better, you get to voice out your fears, your concerns. As a caregiver, they also will need to express their fears.
Yeah, right.
Mm, yes.
So that
Yes.
way the cancer society is there to support and journey with the caregiver as an individual, alongside journeying with the patient as an individual, but together you can still give that support.
Mm,
And then you have your circle of colleagues and co-workers, which who may be able to provide that support at any one time. you know
Yeah.
mm,
that's the way we look at. And there's so many resources out there that, so different phases you may get different support, and it's all
okay.
for you to pick and get them as your team player, your team member, and then
Ah,
you got a team to rally behind you, to support you. you know
right,
when you're
right,
when you're going feeling down, there's somebody to pick you back up,
right,
someone to
right.
cry with you, someone to laugh with you.
Yeah.
you know the
Yes.
support groups, we laugh at each other, we laugh at our bald heads, we laugh at our wigs, we laugh at our flat chests one side, but we are able to laugh, unless somebody who's not gone through that journey laughing at me you know
Yeah, yeah, yeah.
Right.
so support comes in different forms at different phases, different groups of people,
Yeah.
community.
Thank
Right.
you. Thank you so much, Adeline. Thank you very,
Oh,
very
Yeah.
fine.
much for your sharing. I think this has been one of the best answers I've heard
Yeah.
so far. And I hope that whoever is listening, if you are a caregiver, if you're a patient, or even if you're a family member or even public, I would encourage you to, pick up this kind of little tidbits of information, because they really do make a difference when you meet other people who are going through a cancer journey,
Mhm.
right?
And for the
Um,
new diagnosed patient, I mean, you are not alone. Come to
Yes,
NCS and we can connect you with a
yes,
wonderful support, peer support. I mean, maybe if you don't want to be connect with a group of people, we can connect you with the right person, like as a one-to-one. Okay, so feel free to be in touch with us. With our toll-free number later will be displayed. And yeah, like Shana, next thing
okay.
that
Thank you very much, Adeline. We will
thank you.
see you soon. All right.
Yeah, Adeline, you can
Um,
just stay there.
Yep,
yeah, you can
I
stay
will.
there if you
I'll
like.
mute
Um,
myself. And
right. Okay. So, uh, the role introducing the role of counselors and mental health professionals, and this is our last um, topic for the day, right? And I don't have much to say except for that counseling services. What do counselors actually offer, right? And this is open to our patients at NCSM. These services are for free for patients and caregivers and their family members as well. So what are counseling services? So we actually offer individual sessions. We have marriage counseling sessions, right, given. There's family counseling sessions, as well as group counseling sessions that are held together with the peers that Adeline mentioned earlier. Okay. And then we also have mental health assessments. This is when we usually provide you with a mental health assessment called the general and anxiety. It's called the GAD-7, uh, and the PHQ-9, the patient health questionnaire. And through these assessments, we'll be able to assess whether you are in need of a mental health consultation, based off on counseling, whether you need a counselor or whether you need a clinical psychologist, who's
Yeah.
also another facet to our psychosocial support
Yeah.
team, right?
Based on the
And then,
scoring, usually from our mental health assessment, from the
right,
scoring, then we will be able to assist you whether as a counselor we can help you, or else if
right,
you are going through a major depression and all that, so the right person will be our clinical psychologist. So we will refer you to the right
yeah.
person.
Right. And then we have like group support. This is what Malini mentioned earlier. We do have group support for newly diagnosed patients, caregivers, and couples. And I think the most prominent one we have is Pink Unity, right? And the ladies there are one of the most liveliest people you'll ever meet in your life. Shout out to Pin Unity. Okay. Then there's we also do workshops and webinars like this, something like this. We do have things scheduled for cancer patients, caregivers, families, even the public sometimes, just to educate you a little bit on how we provide care to our cancer patients, and those who actually are in need of mental health support. And then there's the end of life care, right? And this is when we actually work with advanced stage patients when they what kind of support they need. We assess that as well. And then last but not least, we do have hospital and home visits. This really helps our advanced stage patients mostly, right? And I think home visits is when they actually experience a lot of relief because they have someone outside of their caregiving system and family members who they see on a daily basis come to their home and talk to them about their life, which is something that they really, really do enjoy, right?
Like
Um,
I still remember, like Shana, I just wanted to share that when
yeah,
recently I had one home visit. I visited this patient. She's quite old, and she is with the advanced stage, like with the pain management and all that. So of course, when checked with the family members, they say, yeah, my mom is doing well. She used to be in the room. We are really provide the best for her. But the moment, like, I had a chance to have this little conversation. So I asked, okay, what was your last, drama or anything that you watch? Do you have any
mm,
favorite?
mm,
Then she said, for the past 2 months, I didn't watch anything. I've been in this room. They give me, like, the
right,
family provides her with tab and all that. But she said, I really miss all my dramas. I really
right,
miss watching movie. So then, like, I do understand, like, these are the those little things that sometimes a person
right.
can really miss. So after
Yes,
that, I do speak to the family member to say, okay, just get a wheelchair, bring your mom out, watch movie together for a while, chit chat with her, makan together. That can make so much of difference.
difference.
So
Yes,
yes, I guess, like, that's like what you explained, like, just
yeah.
sharing.
And it's right and it's true because these are the little things that we notice that the family members and caregivers do not,
Correct.
right? And that's where we come in as counselors and mental health professionals. Our assessment there is very important. This is to show that this is also to help the caregivers see it from our point of view,
Right.
right? And that's really important.
Okay.
Moving on, I think that is the end of no, that's so another one more slide here, right? What
Okay.
can we do for you?
Okay, as yes, we do have a peer support at NCSM. We do have a group support who can share your journey, those who have the similar diagnosis and all that. But as a professional, as a mental health professional, as a counselor, what actually we can do for you? Yes, we help you to come out from the negative thoughts. Like, we assist you, we help you. Okay, then we also teach you to communicate better with others. Some
Yes,
patient, they may have this frustration, not able to do anything. They don't want to
yes,
speak to anyone. They like to isolate themselves in room and all that. So we teach them to have a better communication. Okay,
mm,
we ask them to talk about their concern about intimacy and sexuality. Yes, I will later share about my upcoming workshop, okay, which is
yes,
all about intimacy and sexuality as well, because in their marriage life, they do have a lot of concern. It's something
right,
is lacking. Okay,
yeah,
so we teach them about coping skill. Sometimes it's about their side effect of the treatment. Okay, how
yeah,
to prepare themselves, okay, before they start their treatment and during their treatment. We help you to deal with all your symptoms from the cancer and treatment. Okay, sometimes it, even though it's a small symptom that you makes you feel anxious, make you feel scared, so you can speak to us and we can connect you with our medical professionals, and we can connect you with our in-house doctors. Okay,
yeah,
help you to make sense of your current situation. Okay,
mm,
don't think that this situation is going to be forever. Sometimes they be a changes in your, okay, what you're going through and all that. Help
yes,
you to feel in control again. And of course, we are here to help you to improve your quality of life. Okay, so yes, so please call us. You
If
are
you
not
need
alone
any assistance, we're
there.
always there for you.
Okay,
Right.
next. So
So
yes, as I say, our upcoming events. Okay, so our next upcoming workshop will be about love and resilience, navigating cancer as a couple. If you if you're a married couple, you feel that something is lacking, the spark is not there anymore, feel free to contact us and register yourself with your spouse or with your partner. Okay, we will have our invited guest, Mr. Chan Fun Shin is a really good speaker. So you will be able to get answer for all your doubts and questions related to your relationship and about your intimacy and all that. Okay, don't feel shy. Join us. It's going to be a very close group session, just limited for 10 couples. Okay. So about the next one, Adeline, are you there? Okay. Never mind. So I guess she's here.
yes, there she is. Okay.
This is a monthly workshop that we run. It helps people to put your priorities as we go through, and we have a lot of more negativity in our lives than positive energy and vibes when we are diagnosed. So Suyin is a trainer, and she helps you to put things in perspective and looking at a positive side to everything we are facing in this journey. It's tomorrow morning, but if you want, you can quickly. I'm not sure whether how to go about, but we have this monthly, so maybe next month you can join us instead.
Yeah, it's a monthly
It's
one.
a very
So
interactive workshop. So we break out
Right.
and then we do a bit of sharing and all. Yep.
okay. So the next
Okay.
one will be, they also have the Pink Unity punya monthly workshop. What is this all about, Adeline?
This is Quilling. Okay, Pink Unity is our women support group, very big group of members. So they offer different activities for different members. So Quilling is being creative with just paper. Very interesting.
Mm,
So they just want their members to come together like a club, you know. So they do
Right.
have that sense of belonging when they come, and they offer, other than quilling, which is fairly new, they also have beading, they also have crochet. So just to get members to come together, and while the hand works, the mouth will be working equally. So it's just for friends to come together, you know. Yep.
so it's
Thank you. Thank
nice.
you very much, Adeline.
Okay. So
Right.
so it's
So
Q&A session.
yes.
So let's see if we have question. Yes, we do have about a few questions from our viewers. Okay, maybe the first one. What are some common emotional and psychological challenges that cancer patient face, and how counseling can help them to overcome these challenges? Lakshana, anything?
Okay. So like Malini mentioned just now,
Yeah.
the emotional and psychological challenges are anxiety, stress, um, stress, is body image issues, um, financial issues. I can't list them off the top of my head, but those are the common issues that usually what cancer patients face. And I think Adeline would agree, right?
Mm,
And how counseling actually helps them overcome these challenges is that it doesn't happen instantaneously. Therapy works slowly, okay, and it's very dependent on how therapy is received by the individual themselves. So really depends on how many sessions the patient goes through, and we actually alter our therapeutical methods, our orientation of our theories to match the patient's uh, how the patient absorbs the information we actually provide them during counseling. So that is how they usually overcome these challenges. It does not happen instantaneously, like I said just now. It takes some 2 months, it takes some 2 years. So it's very different from person to person.
Mm.
I
And
hope that answered the
also
question.
remember that counseling is not about like we are there to advise you, we want you to change your mindset and all that. No such thing. We have like varieties of tools, like way for us to work with you based on your needs. Okay, if you think that your stress level is a bit high, you're not able to concentrate on your daily life, not concentrate at your workplace and all that, so that is where I guess like you can start to look for us, and we will be there to guide you and assist you. Okay, so yeah, that is one. Hopefully we have answered your question. uh,
Next question.
Next question.
How can
uh,
family members and caregivers be effectively included in the counseling process to strengthen the support system for cancer patients? Okay, Malini?
as a, I guess like as a family member, of course your role is very very important. Sometimes it's not only like you need to be there physically with your beloved one, but in any form of help that you feel that you wanted to provide them, you still can do. So
To answer
usually
this
we always,
question, actually, yeah, like you said, we they're important, but how they effectively include them in the counseling process, it is actually very dependent on whether the patient wants them in there,
yeah, but
right?
we also do like we speak to the patient first, we get to know what is lacking, what they find that there is a challenge, and then after that we also speak to the family member. If it is
Mm,
necessary, we always have a family counseling also.
yeah,
We go,
yeah.
because I find that the caregivers also will feel like very challenged because they find that their beloved one is not listening to them. My mom
Mm,
refused to take this, my mom refused to take my medication on time, my mom is having an anger problem. So
mm.
in that way, I guess like it's very important for us to speak to you. At the same time, we will try to speak to the patient to make sure that they are on the same journey.
Yeah, they are aligned like that their
Yeah,
therapeutic
correct.
goals are aligned. If they want to be in the same room and they want to speak about their problems, that is when we effectively actually include them in the sessions. Other than that, if the patient or the caregiver decides that they don't want to be included in the session, we don't usually include them. We
Mm,
deal with them separately.
correct.
Yeah,
Yeah, you are
I
most
think
welcome to join our caregiver support group.
yes.
Okay, next question.
Next. Okay. Malini, I think you talked about having different types and stages of cancer, right?
Yeah,
Right.
even though yes, we know that any patient they will encounter stress level and all that, but again, it depends on our assessment. Our mental health screening is a very good tool. It's very important tool for us to identify the stress level of a patient. Okay, so from there we will know how we want to assist them accordingly. Then also it's like their question is working with cancer patient who have a different type. So I guess like when it's come to stage 3 or stage 4, their stress level might be very high. They might have depression, they might have an anxiety attack, panic attack and all that. So in that way, we have a few intervention that will be tailored for the patient accordingly. So sometimes we might apply cognitive behavior therapy. Sometimes if we find that acceptance and commitment is very very important, ACT therapy, that means we are able to make sure that the patient or caregiver accept the whole situation what is going on. So acceptance is very very important. So we have a few approaches when it's come to patient, so we tailor accordingly.
Yeah,
Okay.
I think another way that we can also answer this question is like in terms of the stages of their cancer. So for advanced stage cancer patients, especially those who are not able to speak to us very much, who have like a speech impediment, what we usually do is we tailor our approach in the sense that we try to ask questions that are not going to emotionally burden them even further to think about too much of things. We just try to focus on the things that they want to really focus on, which is to uh, to redirect their focus towards things that they want to get in the next few months to come
Yeah, correct.
at end of life care. Yeah, that is
Yeah.
how we usually tailor our approach for advanced
I guess
stage
like the
patients.
goal is very very important like the first thing that we will do to identify what are you going, how you want us as to help you.
To
So
assist.
once
Yeah.
we identify what is the goal it's going to be, that is where we will help you.
Right.
uh,
Right.
okay.
I hope that answered your question. Next
Okay,
question.
next.
Okay. How should we address a situation where the patient perceives our kindness as stemming solely from pity rather than genuine care? I think okay. I think I have an answer for this, right? Um, with cancer patients, right? Perceiving kindness as stemming from pity. I wouldn't say this is a. It. I don't think this is a very usual occurrence, right? Not every cancer patient feels this way, but if you do have someone who feels this way towards you showing the kindness, right? I would say to continue showing that kindness, because if it is coming genuinely from you, at some point they will be able to feel it. Okay, because this pity thing is more likely to do with a lot of outside stresses that they're going through, especially in hospital environments, because a hospital is kind of a busy environment, and doctors and nurses are always busy and fast, so they always assume that that kind of care is going to be generalized among everybody else in their life. So when you are showing kindness, it may be perceived as pity for them for the time being, but not necessarily will it be like prolonged lah. If it's prolonged, then I would suggest maybe get that person to come and speak to someone about why they feel that another person's show of kindness is coming as pity to them or is perceived as pity for them. Yeah.
Okay, yes. Okay.
Is that
Any
all the
other
questions?
question?
Oh,
Wow,
okay. We have
another one.
one. How can we effectively encourage a cancer patient to communicate openly about their situation without making them feel pressured to do so?
Of course, we
Malini?
don't force anyone. We always give a sufficient time to our patient to open up with us, to start to communicate with us. I guess like some patient, for based on our experience, after the third session only we are able to understand the patient punya real issues and all that. So
Right.
it is not that easy to speak to our patient. Sometimes yes, they just come, they always say, oh, I'm going through this, I just need help, Miss Malini. So how I can overcome my stress level. I feel so much of fear, going for my treatment and all that. If that case is good, but some, they come, but they will have, the trust issue, they are not able to open up and so on. So it's okay. When you are ready, you feel comfortable, you have the trust on us, you can always start
Right.
to
Right.
share with us. Yeah.
And if it's coming from a perspective of a caregiver or a family member, how you can encourage your that person, the patient that you're caring for, to communicate openly, I would say take it one day at a time. Just encourage little bits of talk, like just asking them about their day. And then if they say they don't feel good enough to talk about it just yet, just say it's okay. I'm gonna sit with you. If you want to just talk, if you want to just let me know what you're feeling, uh, yeah, just give me an idea on what you're feeling. It's okay. Any time of the day, I'm going to be available to you. And if you're not available at any time of the day, just ask them to send you a small text. So you can send a small text to them and ask them about how they are feeling. This will actually help them communicate a bit more openly later on. It will take time, but it will slowly help them understand that you actually want to hear about their day, which will slowly actually encourage them to communicate openly later on.
Yeah, just like a ice breaking session whenever we attend a workshop and all these things. I guess like
Yes.
when it's come to counseling services and all that, it's not necessary like straight away we come, we ask what is the issue, how we can help you. We have so many methods and tools like to interact, to start our conversation with you. We use cards, we use our props, we have
Mm-hmm.
used some reflection questions and all that. So you are most welcome to come and give a try
Yeah.
to
Don't
speak
worry,
with us.
we are
Yeah.
always here to help anybody who requires that help. But other than that, thank you very much, everyone who has listened in, who
Yeah.
sent your questions in. We are very eternally grateful for your attention. If you require any more and further assistance, you can actually contact us at the hotline helpline number. Okay, and our cancer information service, our dedicated cancer information service, will actually refer you guys to us. So I hope everyone has a good evening. Thank you very much, Malini and Adeline, for your
Thank
time.
Thank you for
you.
having me.
Thank
And
Right.
you,
enjoy
Adeline.
the,
Thank you, Lekshana. Thank
Thank
you,
enjoy
you.
everyone.
All
enjoy the long
right.
weekend, and Selamat Hari Malaysia to everyone.
Selamat Hari
Yeah.
Malaysia.
Selamat Hari
Bye.
Malaysia. Bye.
Bye.
Thank you. Good night.
Good night.